sit up here and I give a little speech and I talk about certain things, but I want to focus on a PowerPoint presentation that we have on the wall over there as we're going along. Today, what we are revealing is a review that was performed by the Office of Medicaid Inspector General, which, if you may remember, was created last year through a unique joint effort between Erie County and the state of New York, and I'll let Mike get into a little bit more of the details. But this is a review of Medicaid usage for a particular period in Erie County. This is the first time with the creation of the Medicaid Inspector General unit that we've actually been able to drill down the specifics associated with even just one individual, what drugs they use, what race they are, what age they are, what type of services they're receiving. And what we wanted to do is take a look at it in the aggregate. We're not allowed to provide, under the rules that we have under New York State, specifics with regards to one or two individuals, but we can provide aggregate data to show exactly the cost associated with Medicaid. So, what is Medicaid? Medicaid is a joint federal-state health insurance program that assists persons with low income and limited resources. County government administers Medicaid in New York State and pays a portion of the Medicaid costs. Presently, due to various funding adjustments, the state's Medicaid cap, under the current system, Erie County is basically paying 15% of the costs associated with Medicaid expended in Erie County on an annual basis. That still makes up the largest single appropriation account in Erie County's operating budget. So while it is not the former system where Erie County used to pay 25% of all the costs, because of the various funding changes now, we only pay about 15%, but it still is a very large portion. We'll get into more about those particulars in a moment. So what are the mandatory services that Medicaid must cover? If Medicaid is in a state, and of course Medicaid is in every 50 state, all 50 states right now, these are the services that must be covered by Medicaid. Inpatient and outpatient hospital services, physician, midwife, certified nurse practitioners, laboratory x-ray services, nursing home and health care for individuals over the age of 21, other items that are shown here. This must be provided by every state and every community if they're in the Medicaid system. Now here are the things that are optional, that are not necessarily provided by all states, but are actually provided by New York State, and of course then are provided through the Medicaid system in Erie County. Diagnostic, screening, preventative, clinical services, intermediate care for the mentally retarded, prescribed drugs and prosthetic devices. This is going to be important. We'll talk about all that later. Optometrist services and eyeglasses, nursing facilities for children under the age of 21 if it's required, transportation services, which makes up a good portion of our Medicaid costs, physical occupational therapy, dental services. These are optional services that can be provided and are provided by New York. There are a few services that are not covered under the New York plan, and if you have questions on that, I'll turn it over to Michael later, but generally New York covers mostly anything that Medicaid could cover. Now, when we talk about Medicaid, there is a portion of the amount that's paid for by the federal government. It's the Federal Medical Assistance Percentage, FMAP. Now, you heard a lot about this during the stimulus package when the federal government paid more Medicaid dollars and they referenced FMAP. And people always wonder, what is FMAP? Well, it's basically the percentage that's paid by the federal government for Medicaid. New York State, and it has been for quite some time, Erie County used to pay a portion, but the federal government always paid 50% of the costs. In other states, the federal government actually pays more. And the most that any federal government will pay in any state in 2012 is 74%. But actually in New York State, and has been for some time, the federal government picks up 50% of the costs associated with Medicaid. Now, New York State's Medicaid. New York State, as has been referred to many, many times, has the most expensive Medicaid program in the nation. In 2012, New York State expended and covered over 5.4 million beneficiaries at a cost of $53 billion for all of New York. And of course, Governor Cuomo created the Medicaid redesign team, which was tasked with reducing the costs of Medicaid and streamlining the operations, and they're doing that now. And truly, our Department of Social Services is working hand in hand with the Governor's Medicaid redesign team to implement many of those recommendations, and also to advise them when we think the recommendations are not appropriate and other things need to be done. So, what do we have here? We have the Erie County Medicaid Inspector General's Office. And at this time, I'm going to turn it over to Michael, who can talk a little bit more about the Medicaid Inspector General's Office and what they've done just since November of 2012 when they started the field work for their first audit. So Michael, would you like to come on?
Thank you, Mark. The New York State Erie County's Medicaid Inspector General's Office is a pilot program for Medicaid auditing within New York State. And we are funded 100% by New York State as a result of that. In the document that you see before you, well, that's possible because of access to something called the New York State Medicaid Data Warehouse. And access to the New York State Medicaid Data Warehouse was provided to the audit team, or the MIG team, because it allowed us to select our own audit targets. Now, for our very first project, Albany selected our first audit target. And for a well-trained and experienced audit team, it should take us about a month to complete a project. And that's our goal, and over time, we've been very, very close to that goal. The three of us, and it is myself and 2 members of my staff, are here to audit Erie County's Medicaid activity. If you notice, that's in the document, that's about $1.5 billion, that's billion with a B, dollars of Medicaid activity annually, or about $500 million per person for the three of us. As we finished our first Medicaid project, we wanted more independence. We didn't want to receive assignments from Albany. We wanted to be able to go out and pick our own targets. We're familiar with the local economy. We're familiar with the local infrastructure. We thought we would have a better understanding, we'd have a better opportunity of picking successful or productive audit targets if Albany would let us do that. And although that wasn't actually in the original pilot program, we had a chance to talk to them, and they relented, and they agreed to let us select our own targets. So in order to do that, they gave us, that is, myself and my 2 members of my staff, access to the New York State Medicaid Data Warehouse, which is all the Medicaid transactions that New York State processes, and it's live, it's in real time. We received extensive training on this database, and I want to say that the New York State Medicaid Data Warehouse is a very complex entity, as you can imagine. It's all different types of Medicaid transactions, and interpreting the data is itself very demanding. We're grateful that Albany was able to help us learn how to do this. Now, the New York State Data Warehouse allows the audit team to, for example, look at, and I'll pick pharmacies as an example here because I believe most people are familiar with them, to look at Medicaid billings sorted by size. We could say, show us the top 25 pharmacies in terms of Medicaid billings in Erie County for last year. Now, of course, that wouldn't be enough to do an audit. Just because a pharmacy is doing a lot of business, that wouldn't be enough to do an audit. But then we could look at other things, such as later in the document, you'll see prescriptions. And we could say, all right, show me the top 25 pharmacies with the most active prescriptions, or the most prescriptions for hydrocodone, or Ventolin, or other drugs. And if, for example, we're looking at a pharmacy's normal sales, and they begin to slide, but their prescriptions for hydrocodone are increasing, well, that's a flag. And that warrants us spending some time taking a look at them, and spending time there in an audit. And as a matter of fact, that in many ways, that New York State data allows us to make a selection, allows us to select our audit targets. Now, it was while we were doing some preliminary audit work like this, looking at the statistical data to select an audit target, that we noticed the demographic data that you'll see in our report. And I assembled what actually in the document is now Table 18, Table on Drugs, for the county executive's review, and I sent it up to him as part of a routine memo. He was interested in it. He came down to discuss that with myself and my staff, and we agreed to perform a report. We ran that past Albany because we are a pilot program, and we had to make sure that they agreed to this. They did on the proviso that it absolutely not slow down the audit project we are working, which is the primary goal of my office. And we managed to work on it in between different projects. And I think we've been very successful. There were, of course, restrictions placed upon what could be in the document. The original document, as the county executive will attest, was much different. We included different tables. Albany and other entities suggested we take those out because we may, or there's a possibility we might have violated some.
We're not violating any laws.
We're not
confidentiality laws.
To make sure that we didn't do that. So we ended up changing the document slightly to do that. I can say that Albany provided invaluable assistance on this document. They did review the document, and they provided insight and advice. And Mr. Cox, who is the New York State Medicaid Inspector General, and his people have been very generous in sharing their time and their knowledge with us. And we are very appreciative of that.
Thank you. Thank you, Michael. One thing Michael didn't really note is that since November, as we said, they've actually completed 6 audits, which have identified $38.2 million in Medicaid transactions. In the process of completing another 3 audits, which are additional $13 million. So basically, in 1 year, the organization, the 3 individuals, will have completed a grand total of 9 audits, reviewing $50 million worth of Medicaid transactions. So there's a lot they're doing, and they were able to do this project in the middle of doing these other audits. Now, Michael talked a little bit about the Medicaid data warehouse and what it is, why it's important for us, because it breaks down to the person where the money's being spent, where it's going. Is it going to a particular pharmacy? What prescriptions? What doctors are they going to? So we know now, what we never did before, access that allows us to break it down and see actually how the money is being spent, and truthfully, if it's being spent appropriately. Now, Medicaid in itself, what is it? We talked about it. Well, who qualifies for it? The interesting thing I want to note, and I want people to understand this, you can work a full-time job at minimum wage and have one child and still be eligible for Medicaid. You can have a family of four and make $23,550 or less and still be eligible for Medicaid. So Medicaid is just not for individuals who have no jobs. And many of the people on Medicaid are working full-time jobs, but they do not receive health care coverage at their jobs, and they're not making enough money to pay for health care on themselves. So I think it's important to note that just because somebody is on Medicaid does not mean they're unemployed. Often they are. And as you'll see from the poverty guidelines on the next page, looking at a family size, if you're at 100% of the poverty level, you can actually have an income of above minimum wage and still qualify for Medicaid based on the size of your family. So I think it needs to be reminded to folks that if you work, you still might qualify for Medicaid. And we call upon individuals, if they don't have health insurance and they're working a full-time job at minimum wage or less, if they have children, in all likelihood they qualify for Medicaid, and they should contact the Department of Social Services in Erie County at 858-8000 to find out if they qualify and if then they should be on Medicaid. And the poverty guidelines change annually. Those were the 2013 guidelines, but once again, the standard is pretty much the same. If you can be working and poor and basically be in poverty in this community and still qualify for Medicaid. Now, looking at the costs. We ran numbers through April of this year for 2013, but as you'll see, Medicaid has been increasing and continues to increase. It's been averaging a 4% increase annually. In 2012, $1.4 billion was spent in Erie County on Medicaid, $211 million of that from Erie County. Through April of 2013, only $462 million had been spent. We are anticipating, as of the close of this year, that of course it will be more than $1.42 billion. And here's the numbers to show the last few years and the growth. And you will see that while the growth has started to slow down a little bit since 2008, the program is still growing. And it's growing on average of 4% per year in cost, and it's actually growing 4% per year in enrollees or recipients. So while we talk about the great things that are happening in our economy right now, and there are a lot of good things happening in our economy, people are hurting out there. There is no doubt about it, and we're seeing more people enroll in the Medicaid system in Erie County than they had in years past. Now, what does this mean when you look at the costs associated with Medicaid? Well, remember, the federal government pays 50% of the overall cost. Erie County is paying less than 20% now, which means the state government is picking up the rest. And that's why Governor Cuomo implemented the Medicaid redesign team, because with the state taking on a greater portion of Medicaid, it's got to eat those costs. And they've got to find ways to create a better, more efficient system. And that's one of the reasons why we believe this pilot program was put in place here in Erie County, to help the state identify waste, fraud, and abuse that exists in the program so that we can reduce overall costs. Medicaid is reflected in, poverty is reflected in Medicaid clients is not limited to one area in Erie County. It is everywhere. What this map shows, there's a bigger version. Those are the number of recipients per zip code. We never had this data before. Now we do. The dark blue is 0 to 500. The lighter blue is 500 to 1,000. The green is 1,000 to 2,400. The yellow is 2,400 to 5,000. It's 5,000 to 7,500, and then the red is 7,500 and above. So while most people think poor people, they live in the city of Buffalo, it's not true. Look at Amherst. There are 3 major zip codes in Amherst. In each one of those zip codes, there's more than 2,400 people in each of those zip codes. It's on Medicaid, and based on the numbers associated with percentages of people in that zip code, Approximately 10% or more people in those zip codes in Amherst are on Medicaid. Same thing goes for Cheektowaga. The orange area in Cheektowaga, as I said, that's over 5,000 people in that one zip code alone in Cheektowaga, Tonawanda, West Seneca. It's not 5,000, but there's a 2,400 to 5,000 people in West Seneca. So what I want people to understand is that poverty, there's no just place where people live in poverty. Every community in Erie County has at least one person on Medicaid. Every community, every town, whether it's urban, suburban, or rural. The percentages in some of these communities are not as great as in others, but you can look and you can see in the town of Concord. In the town of Concord down there, right here, with the town of Concord, village of Springville, it's over 1,000 people to 2,400 people that live in the rural area that are Medicaid. And it's important that people understand this, because when we talk about delivery of service to serve those who are poor, people think, oh, it's just the city of Buffalo. It's important. It's important in the city of Buffalo. It's important in the city of Lackawanna, Tonawanda, but poverty exists everywhere in Erie County, and we need to address it everywhere. We cannot ignore the issue. Medicaid clients by year in Erie County in total, the average rate is growing at 4% per year or more. In 2008, there were 183,000 people enrolled in Medicaid in Erie County. In 2013, as of April, it was 203,000. Now, you'll see the slight discrepancy from 2012, but we're expecting that the numbers will actually be somewhere around 225,000 or above people once the final numbers are for 2013 are put in place. So even just through April, there were 203,000 people in Erie County through April that were enrolled in Medicaid. And what's the money being spent on, that $1.4 billion plus? Well, it's being spent on everything you can imagine. Now, what we're seeing is the system is converting more to a managed care system. More dollars are being directly identified into managed care. In 2012 alone, $560 million was spent in the managed care system for Medicaid. But you can go down and we can break it down to the smallest categories. Eye care, direct eye care in Medicaid was $551,000, and that's not the stuff that's normally covered under the managed care system. Transportation, approximately $14 million was spent in 2012 on transportation, not including the stuff that's part of the managed care system. So we can look at this and figure out where's the money going. And if we see, as Michael said, great discrepancies from year to year, then we can determine, wait a minute, why did it change so much? What's going on here? We need to look at this in greater detail. And there's a pie chart that just kind of gives you a breakdown of the major categories of that Medicaid is spent on. And once again, managed care, which the system is being converted to, is where the vast, a little less than the majority of the costs are actually being spent this year. Now, here's a demographic number that none of us knew really beforehand, but we can now. We can compare the Medicaid numbers in 2010 to the actual census data. We can't do this in the other years because we don't have accurate census data, but we do have the census data for 2010. And as a result, we can make a comparison to see how many people in a racial group and what percentage of the racial group that makes is compared to the overall amount of Medicaid. We know if somebody self-identifies as a white or an African-American, then they're white or African-American, but now we can compare percentages to the actual total population. And in 2010, there were 97,000 people who self-identified as white, and they received a total of $827 million worth of Medicaid. The average cost per client is $8,527. Blacks, African Americans, self-identified 64,000. The Medicaid cost was $334,447. $5,220 was spent per person on African Americans instead of whites, which was $8,527. And you see the number there based on Hispanic, Asians. If you would like, we can provide everyone a copy of the PowerPoint presentation as you leave, or there is a link to it as well in the press release that we can provide you. But what we see, and this is troubling, and I've asked the Medicaid Inspector General's unit to take a greater look at this. While whites make up 44% of the population that received Medicaid in 2010, 60% of the total Medicaid cost was dollars spent on whites. The average cost for every other racial group is a little over $5,000. For the For whites, it's $8,527. We don't know the exact reason why. We're going to drill in further and find out why there's such a large discrepancy between spending on whites versus other racial groups. We don't know the answer. We don't know if it's related to long-term care. We don't know if it's related to mental health. We don't know if it's related to more tests being prescribed for white Medicaid recipients as compared to others. But this is disappointing to see this because Medicaid is supposed to be a fair system. And what we're seeing is it's unfair in the amount of money that's being spent per person on an average basis. Michael and his team will be drilling down in this much further. Then we look at age group Medicaid costs. And not totally surprising, it costs more to take care of and provide health care for someone over the age of 65 than it does those below. And in fact, we pay the least amount per person on average for children, to a little less than $3,000 a year in 2010. Almost $8,000 a year for the average adult. For seniors, it's $13,500. So, no surprise, it costs significantly more to treat seniors than it does, and children under the age of 21 cost the least to treat. Once again, we're looking at the demographics here and the percentage of the population. 22% of Erie County residents receive Medicaid. 30% of children in Erie County receive their health care through Medicaid. Average adults 21 to 64, 20%, and only 16% of seniors over the age of 65 get their health care from Medicaid. Not a big surprise because remember, when you turn 65, Medicare kicks in. So Medicare takes care of the costs associated with most seniors. So for the average senior, Medicare will take care of their health care costs. If they need significant long-term care in a nursing facility, then Medicaid kicks in. So it's safe to say of the senior population, 16% receive Medicaid, and those are the ones who are usually in a nursing facility. Well, think about it, folks. If you're standing in a room with 10 people, and we've got more than 10 people here, under the current averages in Erie County, at least 20% are on Medicaid. And if it's a group of children, 30%. So 2 out of every 10 people in Erie County were on some form of Medicaid in 2010, and approximately 3 out of every 10 children are on Medicaid. And we also have breakdowns by the percentages of racial population. It's in the report. You can take a look at it. There's a lot of data in there. What percentage of the population receives Medicaid based on race, based on age and race. So we broke it down by a lot. And I want to go through that all today. I've got Doc Burstein up here, and I've asked her to come up in case we have particular questions, but I want you to take a look at these next few slides because they are very interesting. We go back and we can look at what are the most prescribed drugs under the Medicaid system. And the #1 prescribed drug in 2010 was hydrocodone acetaminophen, pain reliever. The second drug is ibuprofen, a pain reliever. And we have an asthma medication, and we have aspirin, a pain reliever. And then we have other drugs. I mean, I truthfully thought it would be blood pressure, things like that. 2011, hydrocodone acetaminophen. #2, ibuprofen. 2012, 2013 through April. Going back to 2008, which are the numbers that we can actually look at, the #1 prescribed drug in the Medicaid system for now, what will be 6 years running, is hydrocodone acetaminophen, which is a controlled substance, more commonly known as Vicodin or Loratam. This drug is considered to be the most abused prescription drug in the United States. And unfortunately, based on reports, as the New York Times report earlier this year, it's the strongest opiates have increased nearly 4-fold over the last decade. Doc, would you like to talk about what this drug does and what it can have in the community?
Sure, it's very addictive. And actually, thank you. This report is it really actually paints a picture of it gives us a snapshot of the health problems that our county faces. So as the report highlights, as Mark pointed out, that hydrocodone and acetaminophen, otherwise known as Vicodin or Loratam, is the #1 prescribed drug in 2010 through 2013. And I think we're all aware that we have a prescription narcotic drug abuse problem in our community. I just want to let you know I have data from the medical examiner's office that 1/3 of chemical intoxication deaths, both in 2012 and 2013, were hydrocodone related. So that's 1/3. And but the good news is that we anticipate that the ISTOP, the new New York State narcotic prescription regulation, will significantly reduce narcotic prescription abuse. So this report also demonstrates that drugs to treat complication of obesity, such as diabetes and high blood pressure, are also very commonly prescribed. And we know that 2/3 of Erie County adult residents are either overweight or obese, and only 1/4 of Erie County residents report that they've ever received any advice about weight by their healthcare professional. Another drug that is on the list is Ventolin, and that's the most commonly used drug to treat asthma exacerbations. And so that's if somebody is sick with asthma. It's also one of the most, so we know that 13% of all Erie County adults have received a diagnosis of asthma, which is almost twice as high as the number of residents diagnosed with diabetes in Erie County. And then among our Erie County children, asthma hospitalization rates are actually the highest in New York State, outside of New York City. So, and that indicates very poorly controlled disease. So we know asthma isn't controllable. It's through our environmental changes. Number one, quit smoking. It's the number one change you can make. And then getting into care with good controller medications. And so we know that many of these changes in health can be accomplished through simple lifestyle changes and support and counseling from the primary care provider. We've got to get control of our community's health. Change that list.
Thank you, Doc. What we are able to do is, as Michael noted, is we're able to drill down to individual prescriptions, and we do have the data on who are the highest recipients of hydrocodone and acetaminophen on an annual basis. We're not allowed to release that to the public. We have provided that information to the state. Social Services is aware, because we want to consider and determine whether these are actual realistic prescriptions that are being used by the individual, or if they're receiving prescriptions and then selling the drugs after they're prescribed on the street. As I said, it's one of the most abused, and it's truthfully one of the most sought after drugs is the hydrocodone and acetaminophen. So we're using this data to coordinate with the Department of Social Services to see if people are abusing the system. We also are looking to see what doctors are prescribing, and if they're prescribing at a much greater rate than others. We cannot reveal that information publicly. We provide it to the state, who are taking it to the next step. So we have tremendous tools at our disposal that we never had through the Medicaid Inspector General's office, and we're using those tools to identify waste, fraud, and abuse in the system, but also to know the issues that we face in Erie County. Because, as I stated, we have this report, and if we just issue the report and do nothing with it, then it's a waste of time. The idea behind it is to try to find ways to address the problems that exist in Medicaid, as well as poverty. One of the areas that we're looking at is the creation, as many of you know, the new medical mall, Erie County Medical Mall at 1500 Broadway, to address the issues related to the lack of good quality health care on Buffalo's east side, which of course is a large recipient of Medicaid. Often Medicaid patients don't go to the doctor until it's too late. We need them to go to doctors, to go to the primary care and dental care sooner rather than later, because the costs are less then. So what we want to do is use this report, as well as the other things that we're doing in the Medicaid Inspector General's office, as a tool to address the problems that create Medicaid, which are poverty. So, in conclusion, before we open up for questions, I want to stress, Medicaid is not limited to those who are unemployed. You can be working a full-time job all year at or above minimum wage and still qualify for Medicaid as long as you have one child. And if you have more than one child, then of course the numbers are much higher. Poverty, as reflected in Medicaid clients, is everywhere. It's not limited to one area of the city of Erie County. 22% of Erie County residents receive Medicaid. If you look at all public assistance, approximately 25% of Erie County residents receive at least some form of public assistance, whether it's Medicaid, temporary assistance for needy families, food stamps, HEAP, the Home Energy Assistance Program. So 1 out of 4 people in Erie County receive public assistance, and a vast portion of them are working. I want people to think they're just unemployed. 22% of all Erie County residents receive Medicaid in 2010. We don't think those numbers have changed that much since 2010. If anything, it may have gone up a little. 30% of children in Erie County were on some form of Medicaid in 2010, and we also believe that that number may have increased a little. The number of Medicaid recipients is growing faster per year than 4%. Keeps on going, which means they're going to continue to have costs. And for at least the 6 years running, the number 1 prescribed drug to all Medicaid recipients is hydrocodone and acetaminophen in Erie County, which is something that we need to look at to determine why it's the number 1 prescribed drug, and is it being overprescribed? Because of course, if it's being overprescribed, then we can cut down on costs.